So what we're trying to do with this kind of treatment is to create some tightening of the area that we are focused on. So for our lovely model today, the aim would be to give her a slightly better jawline, and you can see she's already got quite a tight jawline. So the approach, remember this is tightening, not lifting. There's a very important distinction between those two things. A facelift, if we can zoom in on the patient, would be to do this, to pull things back. Whereas tightening is going to literally give us essentially a shrinkage of that in a nice way of the lower part of this face. So when we're trying to improve the jawline, where the energy needs to go is actually lateral. Because we want to tighten here. Can you see what happens to the jawline when I pinch the skin slightly? So that's exactly what we're trying to do, is to cause some tightening here to improve the jawline. So this is the most important area with any energy-based device, whether it's radio frequency, whether it's ultrasound, in terms of giving us the effect that we want to do. Because this is lifting, but this is tightening. So what we tend to do with Ultherapy, I've already marked out my lines, is to treat in zones. And the reason we treat in zones is because the energy is delivered from this rather nifty little handpiece between these two lines. Hopefully you can zoom in on the two lines. And they correspond to the areas that I've actually mapped out on the face. And what you're going to see now is me doing an ultrasound scan of our lovely model Jess's face. Great. So, if you can have a look on the screen, this is why Ultherapy is my favourite single session treatment to induce skin tightening of the face. Here's an ultrasound of the skin, and it's taken me a long time to feel really confident with this. I've been doing it for about 9 years now. But if we look, we can very nicely see the epidermis coming down into the subcutaneous tissue, and then this layer here is the SMAS layer. The SMAS is the superficial musculo-aponeurotic system, and this is the layer that if you go to have a facelift, a surgeon will mobilize to create a facelift. So what Ultherapy can do really precisely is introduce energy right into that collagen-rich area. And what happens when we put some fractional energy into this depth is we get a contraction. So we get an immediate tightening, and then we get a secondary response where we get healing. And that leads to a much more long-term effect. So oftentimes when patients come to see me for Ultherapy, they will see an immediate improvement, and they love that, but I'll always warn them, that's going to be temporary. It's that initial contraction that I really like to see, because it proves to me that actually the energy has gone into the right place. But what happens then over the course of time, and that can take 3 months, in some patients it can even take up to 6 months to see an improvement, particularly on people who have a slightly finer layer of target tissue, and it can take up to 6 months for that to happen. But so what we can see is Jess is a really good candidate to have Ultherapy because she's got a lot of collagen-rich tissue. And this is why Ultherapy is incomparable to any other generic HIFU, because I can scan, and I'm now going to scan actively, if we can maybe focus in on the actual screen. So here we can see the start of the muscle layer. There's a vessel there. This is actually the bone, this is the mandible. And as I start to move upwards, we can start to see the SMAS becoming really nicely visible. And then it gets a little bit deeper. So see here, you can see some target tissue at 4.5 millimeters. Again, 3 millimeters. And here, there's some target tissue at 4.5 millimeters. So why is that important? It's because we can deliver energy at different depths with the Ultherapy transducer.
Yeah.
So a really popular phrase these days is collagen banking, and people are really interested in keeping their collagen levels preserved. So this is exactly what device-based treatments like Ultherapy will actually do. So a lot of the newer injectable skin booster treatments like Fractional and polynucleotides, they talk about collagen banking, but they don't actually have any massive research to show that they do anything like that at all, whereas with Ultherapy it really does. This is a truly regenerative treatment.